Welcome back to KSNT News at 5. Malnutrition is a worldwide problem, with 8.5 million Americans, including nearly 3 million children, experience hunger on a daily basis.
And the problem, it's impacting people right here in Northeast Kansas. Tonight, KSNT News morning anchor Brittany Moore explains how oftentimes malnutrition goes unnoticed until a patient is admitted to the hospital.
When a patient goes to the hospital, the first thing on their mind is probably not their nutritional status. But for dietitians at Via Christi, checking for malnutrition is a top priority.
We have 13% of our patients actually are malnourished. The national average says older adults, 20 to 50% are malnourished. We tend to see older adults that came and they have been avoiding food, they weren't feeling well, I didn't have a good appetite.
Dietitians say skipping meals is not an option for individuals in danger of being malnourished.
When you don't get nutrition, your body cannot sustain. Little by little, you lose all your nutrients. And so you can easily get sick and you can't recover. Your immune system is low.
To identify a malnourished person, Touchpoint Support Services implemented a new physical assessment for patients when they arrive at Via Christi.
I start usually looking at their face, around their eyes. There's muscle in our face, there's fat in our face, so those are going to be some key indicators. And then I kind of just work my way down. And that's to look for protein loss in terms of muscle, it's to look for fat loss.
Touchpoint nutritionists typically conduct around 10 physical assessments a day, looking out for both macro and micronutrient deficiencies.
The macronutrients like the protein and the fat are the easiest to see, but the micronutrient deficiencies are there as well. They're just a little bit harder to observe.
Malnourished patients are immediately put on supplements while in and out of the hospital. People who live alone tend to be at a higher risk of being malnourished. And for those who don't live alone, weight loss may go unnoticed by family members who see them all the time. If you're concerned a loved one could be malnourished, make sure you seek out medical care as soon as possible. Brittany Moore, KSNT News.
In other health news, fewer Americans